Hello YouTube, Melissa here from my 100 Pound Meltdown, coming to you with my midweek update, midweek of the first week of 2011. And I am staying on track with the goals that I have. This year, my goal is to lose 68.8 pounds, which will bring me to my total loss of 100 pounds at the end of 2011. And I am also participating in Bright Night O2's 30-day challenge of no fast food and no eating out. And I have not done that. Although during the week it's much easier for me because during the week I don't usually eat out at all. So it's going to be the weekends that are going to be very tough for me, especially Saturdays, which because my usual was that on Saturday after I weighed in, I would treat myself. So it's going to be difficult come the weekend for me. But right now that it's been okay. On track for my 5K. I started the Couch to 5K program yesterday. I actually downloaded an app on my phone, which is very cool because it will tell me exactly what I need to do. It runs on like a timer and it says, do the warm up for 5 minutes and then it's jog for 60 seconds and then walk for 90 seconds, and it would do it. And then I'm just going to show you. Then as I complete each day, as you can see, day 1, week 1, there's a green because I have done it. So today I will do week 1, day 2. And I find this is just great because then it tells me, instead of having to print out what the program is, I can have my phone with me and it does a little it does a little bit of a ring, a beep, when the time is up to switch to from jogging or walking. And it was great because the last time that I tried to do some kind of jogging on the treadmill on my own, I must have pushed myself too hard. I think I was trying to jog for 2 minutes and walk for 4 minutes, and that wreaked havoc on my knees. My knees were extremely sore, and I think too I tried to do it for too long. So the Couch to 5K program is nice because it's only it was total 28.3 minutes, so 28.5 minutes of being on the treadmill, and it was just enough that my knees were not bothering me, although my calf muscles were really sore, but that's a different story. It's not about my knees bothering me, which is what I'm concerned about, having had surgery when I was younger. So no, it did not bother my knees, so yay, that was a plus. So I will be doing week 1, day 2 tonight, and then I will be doing week 1, day 3 on Friday. So my plan is to do, I think, Wednesday, Thursdays, and Fridays, Couch to 5K during the week. Mondays I usually do my cycling class, and Tuesdays I try to make it to my Zumba class. So that's kind of my plan right now as far as exercise. I'm going to kind of cut back a little bit on the I had been doing the elliptical machine for an hour and that sort of thing. I'm going to cut back on that just because I kind of want to focus on the Couch to 5K program. So I'm going to, on the days that I'm doing Couch to 5K, I'm only going to do the Couch to 5K unless it's a day that I'm doing strength training. I do strength training every other day. So some days I may be doing strength training and Couch to 5K, but that's why I'm going to do it Wednesday, Thursday, Friday, because Mondays is my cycling class, which I like to go to my cycling class, and if I don't, I only go once a week, but if I stop going, then I have a feeling that I'm going to lose that, cycling class ability. So I want to keep that up once a week, and Zumba, because it's fun. Zumba is so much fun. I've seen some people on YouTube who are going to give Zumba a try for the new year, and I highly recommend it. I'm actually jealous of Leslie is Losing, who has the Zumba Wii. I'm going to go out and try to find that. I wanted it for Christmas, and it was sold out everywhere. So I am definitely going to keep my eye out for that because Zumba's fun, but I'm not very good at it. I'm not very coordinated, so I kind of want the Zumba Wii so I can do it at home and practice kind of the moves so that when I go to class, I don't feel like I'm the single person now who doesn't know how to dance. But anyway, I'm keeping on track with that. I want to participate in Leslie's Losing Challenge. I haven't done my 3 new foods yet this week. I'm going to try to fit it in between now and Saturday, or at least 1 or 2 new foods, and share that with you. I think one of my foods that I want to try is Brussels sprouts. I've never tried Brussels sprouts, and I received a recipe in my email today, which is kind of ironic that I've been thinking about Brussels sprouts and thinking about this challenge, and then I got this email with this recipe for Brussels sprouts. So I think I'm going to give that a try. I'm going to try that between now and Saturday. So even if I just do 1, sorry Leslie, I will try to get in 3, but even if I just do 1, I will post that as part of my challenge. Another thing I want to talk to you about is today is Thursday, and it is conference night. I will be in my conference room tonight from 8 p.m. Central Time, 9 p.m. Eastern Time, as well as tomorrow night. And I thought the topic this week could be losing weight for health. Let's talk about the reasons of losing weight benefits our health, and maybe we can share stories. We could talk. You can talk about what has changed in your health since you've begun losing weight, or what you want to change in your health since you've begun losing weight. And let's talk about the benefits of that. And part of that I wanted to share with you is I get the Weight Watchers magazine. Yes, I love reading this. And in it, there was an article from David Kirchhoff, President and CEO, and it's called "It Really Is a New Day." And I just want to read this article to you because I think it was good. It really is a new day. January always provides a great opportunity to take control of our lives and seek new and better directions. I cannot think of a more important time for us all to do so. In October 2010, which it was announced on ABC, Good Morning America, I'm about to say, and I actually did a blog post on it the day after this was announced, and I'm going to link down below my blog post with the information about this that he's talking about. The Centers for Disease Control and Prevention released a new project projecting that if current health trends continue, the number of people with diabetes could double or even triple by the year 2050. And as many as an estimated 1 out of every 3 Americans could suffer from this terrible affliction. Today, diabetes costs an estimated $174 billion annually in healthcare and related costs. Tripling this would create a $500 billion impact on our healthcare system, threatening to bankrupt it. I was shocked by this sad forecast. How could this happen? There are a number of reasons for the projected rise of diabetes over the coming years, but by far the most direct cause is the simple fact that 85% of people with type 2 diabetes are overweight. I did a blog post on this and how I feel about the diabetes epidemic that they are talking about. So definitely I'm going to link it below. And in my blog post is the link to the actual video that was on Good Morning America talking about this report. Many of us know that the impact of overweight on our health and quality of life is real, and its impact on our healthcare system has become undeniable. I'm sure we can all agree that this terrifying trend cannot come to be. The only way to stop this trend is to reverse the obesity trend once and for all. Few national issues are more frustrating to observe than the obesity epidemic. As a society, we seem to have made so little collective impact, yet for so many, it's not a lack of trying. It's hard to imagine pushing back this epidemic when it feels like our environment is conspiring against us. The experts have even coined a term for this, noting that we now live with an obesogenic environment. We have about 600 more calories per day available to us now than we did 30 years ago. That's a 30% increase according to the United States Department of Agriculture. About 75% of this increase comes from flour and cereal products, caloric sweeteners, and added fats and oils. In other words, we have a lot more junk food and processed food surrounding us all day, every day. During the same period of time, the availability of fruits, vegetables, meats, and eggs and nuts has remained virtually unchanged. What's more, most of us find ourselves on the go, filling up on quick food, eating out at a restaurant, and cooking a lot less than we used to. As often as not, the quick, easy, and inexpensive choice is not the smartest one. We need new and better tools to help us conquer the challenges of our environment. We need resources that can empower us to make better and more sustainable choices. Our reliance on calorie counting has outlived its usefulness. The fundamental issue with calorie counting can be summarized simply. When we feel that we are making an equal choice between 100-calorie apple and a 100-calorie bag of chips, we have clearly gone off track. Today, we are getting 35% of our calories from added sugars and fats. That's just too many empty calories. With its most significant program changed in over a decade, Weight Watchers is taking a stand and moving forward toward a better way. With our new Points Plus program, we are moving beyond calorie counting so that you can start looking at food in a whole new, more accurate way. We are no longer treating calories as a calorie. We are taking a stand for fruit, vegetables, lean proteins, whole grains, and low and non-fat dairy. With our new program, you can still have your indulgences and treats, but we are giving the information and encouragement you need to make a smarter, more sustainable choice. Since September 2007, hundreds of people have been testing this new program, and we are hearing a roaring cheer. They tell us that they are feeling more satisfied, more healthy, and more energetic while losing weight. This new program is giving them tools to address their weight challenges once and for all. We believe that Points Plus program is the right program at the right time to help us reverse the obesity epidemic. Come join us and let's change the world together. Let's start with ourselves and let's spread the word. It's a new day. Let's see. So I just wanted to share that article with you because I feel strongly about the diabetes epidemic, and I am going to make myself one less diabetes epidemic statistic because if you read my blog post, I had gestational diabetes with my son, and my chances of creating or beginning to start type 2 diabetes is a 40 to 60% chance. So I need to lessen that chance as much as possible, and losing weight is the biggest factor. So I hope you will join me in the year 2011 to be one less diabetic statistic for the heading towards 2050, where they believe 1 in 3 Americans will have diabetes. So please refer to my blog post below and join me tonight or tomorrow night at the Weight Loss Support Conference, and let's talk about how losing weight has benefits to our health.